Marijuana use is currently one of the most controversial topics in Texas politics. There are many people who think that it should be legalized, while there are many who are also strongly against it. Now, just to clarify, we're going to be talking about medical marijuana and not recreational marijuana. The difference between the two is that medical marijuana requires a prescription from a doctor in order to be obtained. There's a lot of reasons why people support medical marijuana. For starters, marijuana in itself has a lot of useful medical properties. According to the Harvard Medical School, it can be used as a painkiller, it can be used to manage nausea, and it can even help with mental health issues like PTSD. That leads us to our next topic, which is marijuana already is being used nationwide. According to a study done by the Marijuana Policy Project organization, there are more than 3 million Americans who are already prescribed marijuana, ranging from Nevada all the way up to Alaska. And that leads us to our final topic, which is the prevention of opioid-related deaths. Now, according to the National Institute on Drug Abuse, roughly 21 to 29% of patients who receive prescription opioids tend to misuse them. Between 8 to 12 of these patients began an opioid addiction, leading to, in 2017, the death of 40,000 Americans who died as a result of an opioid overdose. The way we can avoid this with marijuana is substitute the use of opioid painkillers in favor of marijuana, which is a less addictive substance. There are a lot of arguments against the use of medical marijuana. One of the most popular ones is that marijuana can be abused, which is definitely true. However, if we take a moment to look at the damage caused from prescription painkillers as opposed to marijuana, it's pretty substantial. In 2017, about 47,000 Americans died as a result of opiate-related overdoses. However, a study done by the CDC suggests that a fatal overdose with marijuana is considered unlikely. This takes us to our next argument, which is that smoking can be harmful, which again is also definitely true. However, marijuana doesn't have to be smoked. There are other ways of acquiring marijuana other than smoking. One of the ways you can ingest it is by eating it and then having it processed in your digestive system. There are also many oils and ointments that also help with marijuana. And that concludes my opinion on the use of medical marijuana in the state of Texas and why it should be legalized.